of this month's Health Views was to take you on a tour of what happens from the time they reach the emergency room at Grand Itasca. I wanted to just note one of the things that we have learned about the trauma system is that there is good communication between the providers when they're working together. A recent statement came from one of the Duluth hospitals, the trauma program manager, that actually said, "Kudos to your staff for the excellent care to our recent patient. I wanted you to know that you did an awesome job taking care of such a critically injured patient." And that is kudos to these people that will be taking you on the walkthrough.
Our role in the trauma system for the lower Itasca County, northern Aiken County area that we cover, it's about 1,000 square miles, the same role we have on a day-to-day basis with emergency medical response. We arrive on scene, assess, and provide advanced level care for patients. The one thing that we do with the trauma system, as well as some other components of the emergency care system at Grand Itasca, is we look at definitive criteria that exists with the patient, things that are going on with the patient that tells us that we need to trigger a trauma alert. And we'll immediately call and speak to the physician in the emergency department and let them know what we have very briefly and that the time period is going to take us to actually bring the patient into their facility. After that, we'll just continue to provide the treatments, bring the patient here, and then we'll hand off and report to the facility staff when we get here. And we'll also stay around and assist when necessary with treatments, assessments, as well as be available in case there's a transfer out of the facility so that the time from the time of onset of the problem to the time of the person leaving the facility and the care that they get here is all within the optimum amount of time period.
Talking about that call and initiating that call from the EMS Meds 1 to Grand Itasca at the emergency room, it's a direct call that we've set up in regarding to having the paramedic call directly right to the ER physician, so there's nothing in regarding to no time lapse. Once again, as Tim emphasized, in regarding to condensing that to a brief report so that we can prepare to what we know what's coming in and get our teen concept ready. Teen concept, meaning we have a physician, we'll call in also additional nursing staff, we'll call in the surgeon, we also have radiology as well as lab, so these people are waiting and ready to do their roles before even the EMS Meds 1 arrives at our garage.
Okay, we're going to move now to the trauma bay, and we will have Dr. Nyquist and Kathy Helmbrecht, RN, and Tim George kind of go through what happens in the trauma bay.
Well, this is one of our typical trauma bays here in Grand Itasca, and what this provides is it's a private bay. We have the ability to turn up the temperature. We have all sorts of equipment that's available and coordinated for us to be able to provide the care that we need to do. So when we do get a trauma call, what ends up happening is that the staff gathers here, we warm up the room, we get all the equipment that we anticipate that we'll need ready so that we don't have any delays once the patient actually arrives here in the trauma bay.
Should we go ahead and start with Tim in regarding to bringing in the patient in? So let's kind of bring our crowd, our public, into sharing with them what actually happens. When you guys come.
Sure. Our crew members will bring a patient in on our stretcher and bring the patient to the nursing personnel and the physician personnel here. We'll pass the information back off that we also relayed, as well as any updates. We'll start transferring over equipment and supplies and treatment mechanisms that we have available for the patient, IV bags, etc. While we're doing that communication. It's fairly rapid. Once in here also, once we get our stretcher out of here, we have the availability of extra hands, extra skill capability to provide care for the patient. All of the crucial equipment, medications, etc., the paramedics here have the availability to support the staff with, as long as nursing personnel and physician staff require that or would want that to happen, especially in a situation with multiple patients that are brought in.
So going on and to elaborate more into that, it's that team approach concept that we're all trying to share with you, how we work together to really make what's best outcome for our patient and our trauma patient situation. And that's what trauma systems are all about. So receiving that, our patient would be in our room, and as Tim has shared, we have those medications, equipment that we'll be changing on over. Once again, when that patient and meds 1 arrive here, we have that team already in this room. We already have assigned roles. X-ray will be here with the portable X-ray machine. Lab will be here ready to draw any labs. We'll also have certain blood products if that patient needs to have. That's here and ready to go. Nursing staff are ready to switch over their equipment to monitor that patient, assess the patient. The physician, ER physician is here, as well as trauma patients. We'll have our surgeon here to care and ready for that patient. We have the equipment in the room that's ready to be utilized. One of the things as far as also in a trauma system, and we have certain criteria in regarding to certify and training our personnel staff for that to treat our trauma patients. So our physicians are all certified in ATLS, and our nursing staff are all trained and certified in TNCC.
Just to let you know what happens when the patient arrives here is that we really take a very quick but organized look at the patient to decide what's the best level of care. There are times when a patient can stay here and receive the adequate care and the trauma care that they need, but there are many times a patient needs to be transferred to a higher level of care. So that first look at the patient is really about assessing what are their definitive care needs and how do we best make that happen. So there are times patients stay here, there's times we transfer them on, but that is coordinated very quickly in the very first moments the patient arrives.
I'd like to thank everyone that participated in the tour of the emergency room and the description of the level 3 trauma system. Watch us next time when we talk about prostate cancer and the support groups available in the community. Thank you.
Health Views on ICTV is brought to you by the following community supporter. Grand Itasca Clinic and Hospital, an independent nonprofit clinic and hospital, providing patient-centered health care to people in Itasca County and the surrounding region.